All right, I'd like to call this meeting of the Georgia Access to Medical Cannabis Commission to order at 4:03 p.m. As always, I want to welcome my fellow commission members and the staff and the public to this meeting. To start, I'll conduct a roll call, make sure we have a quorum. First is Shane Hudson. Shane, are you here?
I'm here.
Bill Prather,
Here.
Jason Shepard,
Here.
John Stewart,
Here.
Chuck Welch,
Here.
and Danielle. Are you on yet? I don't see her. All right, so we do have a quorum and we'll move forward with business. First is to approve the meeting agenda for today's meeting. Everybody's had a chance to look at the agenda, so I'll entertain a motion to approve the proposed meeting agenda for this August 13th, 2026 commission meeting. Do I have a motion?
So
So
moved.
Thank you, Jason. Do I have a second?
second.
Thank you, Bill. Any discussion of the agenda? Hearing none, all in favor of the agenda say aye.
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 All opposed say nay. All right, we have an agenda. Next, we need to approve the meeting minutes from the July 15th meeting. Again, everybody's had a chance to look at those minutes. Do I have a motion to approve the meeting minutes from the July 15th, 2026 meeting?
So moved.
So moved.
Thank you, John. Do I have a second?
Second.
I'm second.
Thank you, Bill. Shane, you were close on both. Sorry about that.
Trying.
Any discussion? Hearing none, all in favor of passing the minutes, say aye.
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 All opposed, say nay. All right, the minutes have been approved. At this point, I'm going to turn it over to Andrew for the executive director's report.
Thank you, Mr. Chairman. I appreciate the opportunity to serve as a state cannabis regulator for our great state. I want to kick off the executive director's report with some really exciting news. Since our last meeting, we received an update from our partner, the Georgia Department of Public Health, who is the registrar for the Medical Cannabis Patient Registry. And DPH reports the following as of August the 5th, so just a few days ago. The number of active providers in the program is 752. The number of active caregivers that are registered is 2,234. And the number of active patients is 45,356. And that data set, Mr. Chairman, represents a 22% increase in less than a month in the number of registered patients in the program. It's really exciting to see patients continue to come to our program and be able to find access to the medicine that we regulate here with our great industry and patient advocacy partners in Georgia. The provisions of the HOPE Act authorize this commission to issue an additional dispensing license when the patient registry reached that 25,000 registered patients and one additional dispensing license for every increase of 10,000 patients thereafter. So since our last meeting, we obviously know from that data set we reached more than 45,000 registrations as of August the 5th, and we will be able to issue an additional dispensing license for a total of up to 8 dispensing licenses for each production licensee that is in Georgia's vertically integrated medical cannabis marketplace. And those provisions are statutory, of course, as set forth in the HOPE Act. With that, we want to announce a special open application period from September the 28th through October the 2nd, during which our Class 1 and Class 2 production licensees may submit applications for an additional dispensing license. I want to take a moment and also share some announcements and reminders for licensees. Again, that special open application period we just announced, the next regular open application period for dispensing licenses will be October 26th through October 30th. The renewal periods for licenses that expire on September the 30th will be September 7th through September 11th. The renewal period for dispensing licenses that expire on December 31st will be December 7th through December the 11th. And then already underway are our annual production license renewals. So we're already underway with Class 1. That open period began August the 10th and closes tomorrow for our Class 1 production licensees. And then Class 2 production licenses, that renewal period will open up on August the 24th and close out on August the 28th. Those are all the announcements that I have, but Mr. Chairman, we'll move on to the meat and potatoes of this meeting. We're really excited to get to this spot in the agenda today and appreciate the opportunity to bring this one before members. Our staff have worked very diligently since last October, and I'll just express at our public meeting how very sincerely I appreciate the work of our staff. Staff, thank you so much for all of your work. I won't call all of you by name, but it would not happen without the efforts of every single member of our staff here at the commission, and everyone has contributed their time and expertise through the process. What we bring before you, Chairman, is a development of amendment language and new rule language for the Commission's Rule Chapter 351. And those are consistent with the provisions of the Putting Patients First Act. That was Senate Bill 220 that became effective July 1st of 2026. Additional laws were passed that do impact our rules development process, and we certainly have worked to make sure that we are compliant with those. On May 12th, the Georgia Bureaucratic Deference Elimination Act, that's House Bill 1247, became effective, and that act amended the Administrative Procedure Act. It requires state agencies to consider the economic impact of new regulations on regulated entities. So with that said, the work that we're bringing before the commission today has to comply with all of those pieces of law, and we certainly have worked diligently to make sure that we are compliant. Specifically, the analysis of the proposed rules, where the considerations for economic impact of those rules on small businesses were made in accordance with OCGA Section 50-13-4A3. We also consider the effect of rules on charitable organizations in accordance with OCGA 50-13-4A4. And finally, considered less expensive alternatives in accordance with OCGA 50-13-4A5. Moving away from some of the statutory references, which are obligatory, we have to do that. Just want to say on a personal note, we really appreciate the opportunity to meet and discuss with so many different partners through this process. The executive branch, the majority and minority leadership in the Georgia State Senate and the Georgia House, many discussions with legislators throughout the legislative process, as well as regular feedback and communication with all of you, the members. Additionally, feedback from important communities such as the industry and the patients that we serve. We've incorporated the wisdom and guidance from each of these into a work product for the Commission's consideration today to propose amendments to our current rules, as well as adopting new rules that implement the provisions of the new law and continue the Commission's emphasis on ensuring safe laboratory tested products are available for Georgia's registered medical cannabis patients. With that, Mr. Chairman, we've presented the information that members have had an opportunity to look at. We want to thank them for a lot of long, late nights. Several of you you've reached out and had a lot of really great pointed questions. I appreciate those more than you know. I've shared with our some opportunities I've had, and I know that all of you are working professionals, and in your respective capacities. And Bill, that was you for a long time. You're fortunate that you don't have to be that working professional, but you also reached out in your time to contribute to this process and make sure that we get it right. And I appreciate that time that you contribute as members more than you know. But we have provided the information to members for your consideration, and with your feedback, if the commission directs the staff to do so, we will post the requisite notices and amend and promulgate those new rules and begin the public feedback process. With that, Mr. Chair, you know that we have the outline on the agenda for the rules under consideration, both for amendments and new rules, and I'm more than happy to answer questions or provide.
All right, thank you, Andrew. I want to recognize that Vice Chair Danielle Benson has joined us, so I just wanted to make sure we recognized her. Andrew, y'all have done a yeoman's work on these rules, and you've worked with and gotten feedback from several different groups. So I just want to recognize the work you've been doing and your staff. Can you provide a little, some highlights on the rules, to give a flavor for what changes and new rules are coming down the pike? And I want to ask the members if they have any questions or comments along the way to add those as you share those highlights.
Thank you, Mr. Chairman. I think it's important to note that for the public that don't spend their time in regulatory chapter space, it might be good to provide an overview of what we are proposing. With the passage of the Putting Patients First Act, it is a programmatic change for this program. So just to frame it correctly, previously Georgia's medical cannabis program had a 5% THC cap and was limited to low THC oil and some products, a few limited restricted products. The passage of the Putting Patients First Act changes our marketplace to a comprehensive medical cannabis marketplace. It lifted the THC caps. It provides for vaporization products, that's both in raw flower form as well as extract or concentrate based products. With that change, just that change alone, the name change or programmatic change throughout chapters 1 all the way through 8 previously used the phrase low THC oil and products, which was consistent with the previous law. With the passage of the law, all of those references needed to be updated to say medical cannabis. So as you look at the proposed rules, there are, I don't know how many references, dozens and dozens of references, which were previously low THC oil and products and are now reflected with the new law to say medical cannabis. I think that's one of the most important things as you look at what we post and make available to the public in the days ahead. It's important to understand that there are a lot of red lines in every single chapter, but that's one of the bulk changes that really is aligning the program with the passage of the new law. Key points in the proposed rules amendments and in new rules, I would outline in chapters 4, which is related to our production licensees, chapter 6, which is related to our dispensing licensees, chapter 7, which is related to our testing laboratory, and the commission just touch on briefly or add information if commission members have questions or comments. Specifically for chapter 4, aligning new opportunities for our production licensees was really an important consideration with the passage of the Patients First Act. That part of the considerations that we have include modernization and alignment of the Commission's rules to match current practice. So to say it differently, everyone knows that our licensees are responsible for upholding provisions in a license contract. And what we tried to do is to make the production license rules reflective of the provisions and authority that we have in the Act, and also align with what licensees are doing with their license at the production facilities. So I think that it's very strongly an alignment move for Chapter 4 for production licenses. And I'll just simply highlight that one of the amendments that's provided there also affords for wholesale transfer. That's not a free transfer. That's a sales contract to be negotiated between licensees, but that provides an opportunity that doesn't exist in our current rules. And we felt like it was important to align our marketplace along with many other state regulated marketplaces across the country where that is completely lawful. Again, aligns with DEA provisions for a transfer from registrant to registrant if they are licensed and registered similarly. And it's obviously going to provide a pathway for us to track that for anything that moves from one licensee to another. I think that's the big piece of the puzzle for production licenses. The other items that we've revised in Chapter 4 provide clarity and guidelines for items that, frankly, licensees have asked for some more specificity from the Commission on how to be compliant and do a better job with their operations. And we really appreciate that from our industry. And again, I want to say thank you for feedback that they've provided us through this process. We would not be here without a good partnership for that. I'm happy to continue with the overview, Mr. Chairman, or I can pause for these if you'd like to ask questions for each.
Well, I'll ask you to continue, but members, anytime you have a question or comment, please interrupt.
Sure, glad to do that. Since we're virtual, I always encourage people just blurt out. It's tough to raise your hand or interrupt virtually, so feel free to just elbow in if you do have a question or comment. I think one of the more exciting changes that we have is certainly in Chapter 6 for dispensing. One of the components that I think is going to be of interest and especially beneficial for patients is language that we have in our proposed new rule adoption, and that will provide for delivery. Everyone knows that Georgia is a very large state. We have a large geography. Everyone knows that patients have had many struggles through this process to get access to the medication that we regulate. And what we have provided is really with not only the DEA rescheduling for state regulated medical cannabis program, but especially the provisions of the HOPE Act, which give the commission authority to outline tracking and requirements for sale and dispensing of products. One of the greatest value addeds for a state our size, where patients in many areas are having to travel 2 hours or more, either into a congested metropolitan area or around large geographic divides, whether that's the mountains, the rivers, or the lakes, and it makes it impossible to get east to west across our great state. This will provide the opportunity for our dispensing licensees to be able to ship directly to a patient's home. And I'll just touch briefly on requirements for that. This is for in-state dispensing via delivery only. That dispensing will occur through either the United States Postal Service or through a private carrier, and it can only go directly to the registered patient at the patient's address that's on their card. So the dispensing process is exactly the way that we dispense at a dispensary. The biggest difference, of course, is obviously that a transporter will carry that from a dispensary directly to the doorstep where that product is going to be received by the patient. One of the greatest added values, in my opinion, it's my personal opinion, but I think it's going to be hard not to agree with me, is that for the new provisions in the HOPE Act, where healthcare facilities such as long-term care facilities where patients are permanent residents and they cannot drive and they're not mobile, they can get a card with the Department of Public Health and make the purchase on behalf of the patient. This creates a much more secure transaction for that healthcare facility to be able to make a purchase at our dispensaries and have that shipped and delivered securely to those facilities without presenting a risk for diversion, without presenting a risk for, frankly, theft, robbery, an attack in the parking lot. A lot of those security and safety concerns that are our responsibility to try to look out for. We think this provides a great pathway. It maintains the same tracking standards that the commission has. And again, it really leverages the authority in that DEA rescheduling order for state regulated medical marijuana program. Without these regulations, we don't have guidelines in place for things like delivery. We think it's really important to put those guardrails in place and establish standards. I think that's probably the most notable component. There are other considerations as it relates to dispensing licenses, but I think that one is certainly new, and I think it's new for our state. It's not new for the nation. If these provisions are adopted after we have a public feedback period and the commission considers that feedback, if the commission decides to adopt it, it would make Georgia the 31st state in the nation to provide for delivery services to patients from a dispensary. So certainly trying to align, again, our program with best practices and national standards, and that's one of the goals that we had promulgating these rules.
Great. Well, thank you for those highlights, Andrew. Any question or comments from the members?
I have a question.
Yes, sir.
Andrew, who pays for shipping?
That would make, thank you, Bill, for the question. That would certainly be determined by the dispensary. I'm going to make an assumption that they would pass that along to the patient who's making the purchase.
Okay.
Good question. Any other questions or comments?
I'll make a quick comment. I just, again, want to express my thanks to the staff for all the work that they did on this, especially in the parts that touch my world a little bit in healthcare, the testing rules that had to be adopted for a new route of administration and a new class of products that we didn't contemplate previously. I think the work that's been done in the testing panel that's been generated for that is robust and with patient safety in mind. So thank you all very much for that. The other piece that will be adding is for the research permits. And I just wanted to say that that's one of the most exciting parts of these new rules to me is the ability for these state institutions to um, use the products for research to kind of broaden and make our state a leader in developing new indications and confirming indications for these products. So I encourage the industry and the state institutions to really take advantage of that.
Good. Thank you for those comments, John, and thank you for your work in perfecting these rules and for all your feedback. So thank you for that. Any other questions, comments? All right. Hearing
Hey,
none. Yes,
just
Danielle.
really quick. Just, I know I speak for Bill too, from us being here from the beginning. The tremendous lift and the work that Andrew and the staff have done are applauded, appreciated. I don't think we can underscore enough how much work they've done after hours, before hours, weekends, nights to get these rules done. So we appreciate them very much, and I want the public to know that.
Great. Thank you, Danielle.
And
And you and Bill have carried a heavy load since the very beginning, and we appreciate your service. Jason, I think you had a comment.
right, I'll just echo that. The public doesn't think about state employees emailing and doing work on weekends as well, but we certainly got emails from Andrew on Saturday with updates and discussion and everything else. So I think it just is a testament to the staff that they may be government employees, but things don't end at 5 o'clock, and it's 24/7 doing the work of the state of Georgia.
Yeah. Thank you for saying that, Jason. Very important. Any other comments? All right. Andrew, I think we'll move on from there. And Andrew has well stated that Senate Bill 220, Putting Patients First Act, significantly changed our business. It was passed in the last legislative session, signed by Governor Kemp. It was effective July 1, and two things happened on that July 1 effective date. One, new products hit the marketplace. New medical cannabis products and product types were present in Georgia for the first time. These new products are compliant with the new law, as well as the Commission's requirements to ensure these products are safe through independent laboratory testing requirements. And I want to thank our licensees for working with staff to ensure that those products were safe and are safe for patients. So we appreciate our working relationship with them. The second thing that happened is the need for rules, as we have been talking about. And we've developed rules amendments, which are informed by field practice and the work of the commission staff, licensees, feedback from many stakeholders to improve the quality and safety of testing requirements and security for products. And I appreciate the hard work, as we've already said, not only of our staff, but also the stakeholders who have worked with us. Commission members have had the opportunity to review the proposed rule amendments and the newly proposed rules and have provided their feedback. The work by our members and staff are a reflection of our commitment of making informed decisions for safe products and for the well-being of our patients. With that, I'm pleased to announce that we will post notices of our intent to amend the Commission's rules and to conduct a public hearing to receive public feedback. Those notices are expected to be posted by August the 15th, 2026. We are proposing to make amendments in Rule Chapters 351-1, 351-2, 351-3, 351-4, 351-5, 351-6, 351-7, and 351-8. Additionally, we are proposing the following new rules: 351-6-.11, which concerns delivery; Rule 351-8-.07 regarding factors for product recall; and Rule Chapter 351-9 regarding research permits. The proposed amendments and rules will be publicly accessible on the Commission's website at www.gmcc.gov and also provided on the meetings page of the commission website when the meeting date is announced. Once the notices are posted, I invite the public to review the proposed rule amendments and provide feedback. This is a very important part of our democratic process, so we look forward to hearing from anybody who has feedback for us. The deadline to submit written feedback is September the 9th, 2026. The public will also have the opportunity to provide feedback during a public hearing on September 16th, 2026 at 4 o'clock in the afternoon in the commission chambers located at 254 Washington Street, 4th floor, Suite 420, Atlanta, Georgia 30334. Again, the notices will be posted on the commission's website no later than this Friday, August 15th, and those will provide specific details on how to sign up to provide in-person comments to the commission, or alternatively, to provide feedback in writing regarding the proposed and amended rules at the public hearing. All right, so we'll be posting those rules momentarily. For the commission members, Andrew has reported that our amended and proposed rules comply with OCGA requirements. And so we need to vote on both the amended and the proposed rules to certify that compliance. So first, we'll deal with the proposed rule amendments. And I'd like to entertain a motion to confirm that the formulation and intended adoption of the proposed rule amendments to Rule Chapters 351-1 through -8, which will, well, let me read those out. Rule Chapters 351-1, 351-2, 351-3, 351-4, 351-5, 351-6, 351-7, and 351-8. So the proposed rule amendments to all those rule chapters, which will be posted on the commission's website by August 13th, 2026, do comply with the requirements set forth in OCGA 50-13-4A, 3A through D, and 50-13-4A and 5. Do I have a motion to that end?
So move.
Thank you, Bill. Do I have a second?
Second.
Thank you, Jason. Any discussion of this motion? All right, hearing none. All in favor of the motion say aye.
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 All opposed say nay. Motion passes. And we're going to have a similar motion for the proposed new rules. So I'd like to entertain a motion to confirm that the formulation and intended adoption of the proposed Rule 351-6-.11, Rule 351-8-.07, and Rule Chapter 351-9, which will be posted on the Commission's website by August 15th, 2026, comply with the requirements set forth in OCGA 50-13-4A, 3A through D, and 50-13-4A5. Do I have a motion?
So moved.
Thank you, Jason. Do I have a second?
Second.
Second.
Thank you, Chuck. Any discussion on the motion? Hearing none. All in favor of the motion say aye.
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 All opposed say nay. Great. Motion passes. Thank you very much. I'm going to pause just a minute. Any comments from the members? Any questions? All right. Hearing none, we'll move toward adjournment. I'd like to entertain a motion to adjourn the meeting. Do I have a motion?
So moved.
Thank you, Shane. Needed that one. All right. Any seconds?
Second.
Thank you, Chuck. Any discussion? Hearing none. All in favor of adjournment, say aye.
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 All opposed, say nay. All right. We are adjourned. Thank you very much, members. Appreciate your hard work.
Thank you.
Thanks, everybody.
Thank you.
Bye-bye.